So good afternoon, everybody, and welcome to the Business Reopening Workshop for Indoor Dining at Restaurants and Food Premises. It's being presented today by our friends at Ottawa Public Health, and our presenter today is Dr. Sarah Funnell. She's the Associate Medical Officer of Health. The Ottawa Board of Trade is absolutely thrilled to be co-hosting these very valuable workshops for businesses in the Ottawa area. Everyone is welcome, and we're so glad that you've joined us today. I'm going to just turn off the little chime as people come and go. And so now I'd like to introduce you to our presenter today, Dr. Sarah Funnell, and she is going to lead us through a little bit of an update on the new requirements for our restaurants as they venture into indoor dining, and then we'll move into a Q&A session. So Sarah, if you're ready, over to you.
Well, thank you very much, and thanks to all of you for the kind invitation. Often, we hear about the heroes. Those are often referred to as our healthcare workers on the front line as being heroes. Sometimes you even hear that public health staff are heroes, but I do want to recognize that the real heroes in the COVID response are our community members and our economic partners who have made lots of sacrifices to protect the public and protect all of us. So I want to acknowledge the important role that you play in protecting our community. So thank you for the opportunity to come and speak to you today. I'd be remiss if I didn't take the time to also acknowledge that we have the honor to work, live, play, and love here on the traditional unceded territory of the Algonquin people. I myself self-identify as a First Nations public health specialist and family physician, and it's been my life's goal to improve the health of Indigenous people and all people. So again, thanks for the invitation. I also want to acknowledge the important role every employee at Ottawa Public Health plays in this response, and the support that us that get to be the spokespeople have from our various team members that prepare us, synthesize all the documents and information that we receive, because there's certainly quite a plethora of these guidance documents. So I can imagine from your perspective how overwhelming that can be as well. So for today, we had intended on discussing infection prevention and control practices and COVID control measures, and to review strategies for safer reopening and discuss common challenges. So I know that so many restaurants have opened. I see them in the community, and I'm just so thankful for all the careful attention our restaurants have paid towards making sure that we feel safe. It's certainly really important. I want to reflect on some other countries that didn't have the closures that we had here in Canada. Particularly Sweden is a good example where they didn't have any mandatory closures or lockdown as it's often referred to. And despite that, the economic impact to the business community was extreme. So for example, even though cinemas weren't closed, attendance was down 95%. And that's to say, I think, my interpretation of that is to say that as community members, we want to be social, we want to return to some sort of new normal, but we want to feel safe in doing that. And so it's our collaboration with the business community as a public health entity to ensure that people are as safe as they can be, and that you are prepared with all the knowledge that we have to share with you to ensure that people feel safe. COVID is so sneaky. COVID is a virus that sneaks into places where there's crowding. So crowded workplaces, crowded living places, and crowded social settings within homes or other. And so as much as we can do to block the virus from being able to sneak into those places is where we're going to have the most success. And I'm very hopeful that our mandatory masks will really help control COVID, in addition to all the things that you're doing to protect the public. So, you know, I'm a social person. I have a husband and 3 children and a dog and 2 cats. And the lockdown has certainly played a toll on all of us. And we know that a thriving economy is good for the health of the population. And those social networks are so critical to that feeling of belonging, and social connectedness is so important to our wellness. Work, being able to work is such an important determinant of health. And those social supports that we need to thrive, those social supports we gain from going to work, as well as knowing that you're contributing to society, as well as you know, contributing to your home and your own personal economy is really important for our well-being and safety and our overall health. And a safer reopening, which you've already been engaged in, thank you very much for that, will prevent or delay the transmission of COVID. And I think we're already starting to see that. I'll be honest with you, there are, of course, are challenges. And we're a local public health entity, and we apply provincial guidance in our local context. At times, we can even make our own bylaws, like the mask bylaw. However, the provincial government has the authority in many cases over public health law and legislation. And sometimes we don't receive a lot of advanced information. So we've experienced that in the past, over the past few months, with reopening announcements, yet locally not really having all the guidance we'd like to have to support our businesses. So these have been some difficult scenarios. At Ottawa, OPH is really, I mean, I'm so honored to work at this organization. We really do set gold standard in a lot of senses and anticipate where we need to. So we are committed to providing you the best information that we can when we have it, and if we can't, we'll seek to find the answers with our province or Ministry of Health. I don't want to overcomplicate things though. So really what we have right now in the absence of a vaccine or really good solid treatment for COVID, and there's more to come on that in the future. But for now, really what we have is really basic. So outdoors is safer than indoors. Being as distant as you can from others that you don't know, that aren't in your family circle or social bubble, is the safest thing. Even though we can have indoor gatherings up to 50, that doesn't mean it's the safest thing. And we're really coming to realize the importance of mask wearing. We need to do some more analysis in terms of our epidemiology, our local epidemiology, but it's looking quite promising that masks are going to become a critical intervention. And in terms of being business owners and operators, really your role is essential in ensuring that your staff don't come to work sick. And that's an important role that you can play. I can't understate the important role you play in keeping us all safe. So I alluded to this messaging that our wonderful comms team developed with various teams called Be COVID Wise. So that's wearing that mask, isolating yourself when you're sick, keeping that distance, of course, hand hygiene is critical. All these things are important for everybody, particularly business owners. You are leaders in our community, and we see you as partners in promoting this messaging. So the general practices for infection prevention control in your settings, in dining settings, is to provide or mandate the wearing of masks, for example. Again, I can't say this enough, ensuring that your employees are not coming to work sick. And then to look at how you can organize your spaces and your shifts to reduce contacts, staggered shifts. These curbside online options are also effective, enabling that physical distancing. There's some really interesting things out there in the community. I see it often the way people have maybe branded stickers on the floor or signage or arrows. And crowd control. It's been really, really cool to see how creative people have gotten in this endeavor to physically show people what physical distancing looks like. And I'm always surprised that it's actually farther than I think it is. So that's really helpful. I was in a store the other day, and I didn't realize that I wasn't actually on the sticker, and I had kind of cinched up to the person in front of me, and that was a good reminder, oh, back up. So there's some pretty cool things out there. Of course, practice and promote hand and respiratory hygiene. And so there are ways to influence the public to do that and to remind them. Crystal Taylor, who's on the webinar here, did a really cool project with our partners in the food bank in rearranging the food bank so that people could make the healthy choice right in front of their face. And so we've noticed that, like, as soon as you walk in, the fruit and vegetables are right there in front of you. So you're prompted to see that first. And you can do that with, and I've seen it already out there, how people and organizations and businesses remind people about hand hygiene. Or they have someone there that says you can't come in until you clean your hands. And then I can't stress enough the importance of cleaning and disinfecting frequently. I know as a consumer in Ottawa, when I walk by a patio and I see the servers wearing masks and see them cleaning the table, I feel more reassured that that's the place where I want to have a meal. And as you do in training your staff to serve alcohol safely, this is the same. Train your staff to be COVID wise with all of those elements that I've already mentioned to you. We have some tools to help you do that. Health screening. This is the role that you play that's so important to not have people come to work sick. Ensure that your staff have been screened. There are techniques to serve food while maintaining a safe physical distance. And so we can help you with that through our guidance documents. This next bullet is super important. So what we've seen, to be honest with you, is when we see a workplace where there's been transmission of COVID in the workplace, it's often the staff socializing at breaks and in a lunchroom. And so lunchrooms, we're all like, oh, the lunchroom. So it's very important for your staff to know, not only do they have to be thoughtful about their interaction with clients, but they have to be thoughtful about interactions with each other while at work. And so in order to promote the the COVID-wise, if you can provide staff access to mass ways to clean up, that will allow that healthy choice to be an easy choice. I'm sure as restaurant owners and operators, encouraging frequent hand washing and avoid touching the face is already something you're very familiar with, and so it remains important in COVID. Keeping a staff log also helps us with our contact tracing, so we require that as well, and we have some tools to help you with that. Here's an example that our teams put together in terms of employee screening, questions to ask. It's really simple. Our graphic designers are top notch, and this is available to you to use. So please feel free to download these. And at the end of the presentation, we have some links to resources for you. For customers, not only do you not want staff coming to work sick, you don't want customers coming to your workplace sick and exposing your staff or other clients. So we have signage available for you to use, and I've already seen some of this out in the community. We have some things for you you could use signage for reminding people to wear masks. So at the same time, there's a lot of tension and stress and anxiety related to COVID. And so we're trying to remind people to also be kind to one another. Not everyone can wear a mask for certain reasons, and we don't expect owners and operators to police mask wearing. That is not what we expect, but to show kindness as best as you can, and to remind people the importance of masks. Masks are important because, like I said, COVID is very sneaky. It gets into crowded living spaces and workplaces, and a mask is a barrier to that. So if I have COVID and I wear a mask, it protects you. If you have COVID and you wear a mask, it protects me. So it's that kindness. It's a source control. The masks that we're promoting are for source control. So I hope that is clear, and your role in that is clear. And of course, there'll be opportunity for you to ask questions. And what we know at this point from the evidence about population level data of populations and communities that wear masks is that the rate of COVID is lower, but more importantly, the rate of death related to COVID is lower. And so it's a simple yet powerful and important intervention, but does not replace distancing, which also remains extremely important. So, so we do have the temporary mandatory masking bylaw, which is about to retire. I don't know if that's the right word, expire. And we're planning on extending that. We're working with our municipality on that, and more to come on that. And again, I can't stress enough that it's an important intervention. So here's that signage I mentioned earlier. We have multilingual signage for you to use, and we'll be updating it as the mask bylaw also is updated. And I spoke earlier about some exemptions. So young children, children under the age of 2 are not advised to wear masks. I don't know if you've ever had young children, but it would be very challenging. But some young children over the age of 2 are successfully able to wear masks. But there's some adults with certain conditions and cognitive challenges that make wearing masks not possible. So there are some exemptions to that, and we have to be COVID kind and understanding with that. So again, important to note that employees of your organization or businesses are required to provide a verbal reminder or your signage, but we're not required to ask for proof of exemption to wearing masks. So the mask bylaw extends to public enclosed spaces. And so not all places where you or your staff work are considered public enclosed spaces. So those would be non-public areas, although we would encourage mask wearing as much as possible in all settings. So office settings, if you're working close to somebody or you spend a lot of time with another coworker in an enclosed space, yet it's not public, we highly recommend mask wearing. Retail setting behind plexiglass, it's not required, but it's would be wise to do so. So just to understand the difference between what is required under the bylaw and what is recommended. So there may be some slight changes to the bylaw coming up that may include other spaces, outdoor spaces, but I don't have any details on that at this time. And again, that reminder that distance is really, really important. And it's not and masks are not a replacement for distance. So some tips for you. I must admit, I've never owned or operated a restaurant. So, you know, some of what we are saying, we've worked with partners on this, but we, you know, we're here to hear what your challenges are in some of this, so we can help work with you. But of course, you know, ensure food safety, which you're familiar with anyway, and environmental cleaning before opening. Prepare your space with some of those reminders and ensure that tables are distant from each other. Develop protocols in the event that a case within either a client or a staff member becomes unwell with COVID, what you'll do. Ensure safe, active operation and expectation for public health inspections, which as restaurant owners, operators, you're already familiar with already. Again, just a reminder about preparing that physical space, arranging seating in an area that can maintain a space of 2 meters, and then to limit the patrons per table. Remove that waiting area seating as well. So those visible markers are really helpful. Buffets are an area that people crowd around, so we're not allowing that. Of course, the directional arrows that I've seen often out there already. And just a rearranging the space to make the healthy choice the easiest choice for people to ensure physical distancing. And again, those protocols to be COVID-wise. Signage is helpful. Passive screening for your customers, putting up the signage to remind them if they're not feeling well to not come into the restaurant. I've heard some things about reservation-only dining. It can help with contact tracing for sure. It can help with crowds and people waiting. That contactless payment to be encouraged. Menus that multiple people, like to prevent multiple people from touching the same thing. Utensils that multiple people won't be touching, and those think about. So when you're setting up a table, think about minimizing the amounts that people can touch an object. So we know that COVID is spread through respiratory droplets when you cough or sneeze or talk or sing or yell. and that's the main spread, but we also know that COVID can spread if I cough or sneeze on the ketchup container, and then someone comes and touches that and then touches their face. So it's spread by both that respiratory route and contact. So as much as you can to minimize multiple people touching the same thing is what we recommend. Reminding people about all of those things, those COVID-wise messaging is really important. Again, having hand sanitizer around so people can use them and are reminded. So I talked about this earlier, the indoor gathering limit of 50 does not apply to indoor dining establishments. I realize I didn't say that before. We do allow an indoor gathering limit of 50. This is set by the province, not locally, but that doesn't mean it's the safest thing to do. And then again, that for indoor dining, ensuring that patrons can be distant from each other is really important. So if you could, this is a requirement now, record keeping for contact tracing is super important and would assist us greatly when we do our work in contact tracing. So I don't know if you know this, you likely do. All cases of COVID are reported, all residents of Ottawa who become cases of COVID are reported to local public health, to Ottawa Public Health. We have a team that contacts every person that becomes a case of COVID. And that team then does all the contact tracing or the surrounding that single case. It's a lot of work. Contact tracing now has become even more complex. So when you hear that our cases are low, that's great. It's really great. However, each of those cases has multiple contacts that we have to call and monitor every day for 14 days. So if we can make that easier through your record keeping, which you're required to do now, it will assist us greatly. So again, your role in preventing COVID, reducing the transmission, and helping us with contact tracing is really critical. So I appreciate you keeping logs of your clients and staff in the event that we need to contact you for that information. Public health law in this case does supersede privacy law. So public health law is very powerful in that it can trump other laws in order to protect the public. So if there's a threat to the community or the public in terms of a public health threat, providing what would normally be thought as information that should remain private no longer comes into question. We do have some sample log templates that you can take a look at. And so just as your regular safe operations of your business, it's really important to have an appointed person to oversee the adherence to such protocols. It may be an owner, it might be an operator, it might be a manager, but it's really important that they can identify the need for all the protocols to be in place, and that will assist us greatly. So much appreciate that. I probably sound like a broken record, but it's really important that that we all understand the importance of hand hygiene. The customers be seated, avoid crowding around bar areas or doorways or bathrooms. Clean and sanitize those tables between customers. And as I said, as a community member, when I can see that being done, it makes me think that's the place I want to go. And then I said earlier that COVID is spread through respiratory droplets when you talk, cough, sneeze, sing or yell. And what we know is that having background music usually makes people lean in, speak louder, and at tables when you're taking off your mask and doing that, it increases the risk of virus transmission. So highly recommend not having loud music playing at this time. And of course, I didn't realize how much people in Ottawa love live music, love to sing since the start of this pandemic. And people are asking us, when can we sing again? When can we play music again? When can we gather and go see live music? And as a music lover myself, I've felt that loss as well. And so we do, the province has set out some restrictions, but is allowing some live music and entertainment in specific situations. I don't know if you know this lovely lady, but she's one of our public health inspectors. We have such a knowledgeable team on infection prevention and control. Much more knowledgeable than I am at times about specific cleaners to use and what they can kill in terms of viruses and bacteria or what have you. So we have a great team at Ottawa Public Health. You know the inspectors. Likely you already have established relationships with them, that they come and conduct inspections for food safety and now the COVID guidance. They will always identify themselves and the reason for a visit. We have heard some impersonators out there, so that's interesting, but they will always identify them and you likely already know them. They will ask some screening questions before so they know they're not interacting with someone that might be unwell. We at Ottawa Public Health have our own daily screening to ensure that our staff are not working while sick. In the past, I think you were probably provided a paper copy of the inspection report. Now for safety, for COVID safety and risk of transmission, it will be emailed to you. We do have a list of some resources for you here and on our website. So we do have a business toolkit, some reopening guidance, which you likely have already received. That is on our website, as well as many of those tools that were shown in this presentation for you to download and use. Please do that. I love to see all of those things when I'm out in the community and knowing that our messages are getting through. So thanks again for your time. I can't stress enough the important role that the business leaders in our community play in reducing the transmission of COVID. We've already seen such great collaboration with our business partners, and you're critical to the response. So once again, thank you for being the real heroes in all of this.
Okay, Sarah, thank you so much. That was very informative, and thank you. We're going to go into the Q&A session now. So Sarah, if I could ask you to stop sharing your screen. We will be circulating the presentation slides so that you'll get all of the links and resources. So don't worry about trying to grab those. And I've also put a few links directly to Ottawa Public Health's website into the chat, including the samples of the workplace log for staff and the workplace log for your patrons. And I do encourage you as well to download some of the visuals that you can put in your business. One of the most important things that you can do as a business owner is to set an example and build confidence in the consumers. And if they know that you are adhering to Ottawa Public Health guidelines, they will be much, much happier and more confident about visiting your place of business. So we have a relatively small group today, so if you feel comfortable doing so, I invite you to turn on your video and unmute yourself to ask questions. I'm sure that people are going to have questions about the contact tracing and about things specific to their own businesses. So let's start the Q&A session now. If you're not comfortable, you can always pop your question into the chat and I'll watch those while Sarah's answering other questions. So if I know that we have a couple of folks here actually from a golf course. And Lori, I'm wondering if you had any specific questions that you'd like to ask Sarah for the dining portion of the golf course.
So technically, in one of the slides, it said that people should seat themselves. How is that safer than having a meter, greeter, seater?
That's a great question.
The idea of that is to direct a client, customer to the seating area to minimize the interaction between your staff and a member of the public and to promote physical distancing. I also have my support person here, Crystal. Please jump in if there's anything else you want to add to the answer. As well, you know, we still have a lot to learn about COVID and what works best. And so what we're providing you is the best information we can at this time. And as we learn more, these things may change over time. But as much as you can reduce the interaction between people that aren't in the same social bubble, so it's about time and it's about distance. And having people seat themselves if they know where to go can potentially make the difference.
Thanks, Lori. Judy, is there anything specific that the members of your BIA are wondering about in terms of restaurants that you'd like to ask?
Sorry, I just had to step away for a second.
Sorry.
We're busy in the office. That's okay. I haven't heard anything specific. I've been sending these links out to members just to see if they're interested, and then I just come on just in case there's anything new for us to share with them. Most of our restaurants are well established and have been around for quite a while, and I think it's just for them, it's staying on top of it and the ever evolving changes, right? I think that's for them and all the businesses across the board would say that everything seems to be changing on quite a regular basis, and every time they get used to one way of doing it, it's another leap in. And we know that when not all of our restaurants are offering in-house dining yet, a lot are strictly sticking with patios. Some will do in-house dining during one meal, but not all the meals during the day. And others really felt like they had to get running the patio firmly under control and do it safely. Or it's a staffing issue and they don't have enough staff who are coming back to do both. So they're just focusing on patios.
Have you had any pushback from your member restaurants that are concerned about the contact tracing obligations for their patrons?
I haven't heard of any. There was a few who sort of knew it was coming, but they needed reminders to start it on Friday. And they were like, how do I do it? I'm like, just download the template. It's easiest. Others have fully on moved to a scan code system. When you sit down at their table, you have to scan it and it automatically loads your contact information into an app. And that's how they're tracking. And then we have others who there's some pushback and they basically say, you're not welcome. If you're not prepared to play the game, you're not welcome in our restaurant. If you're not going to, that like, you know, like you could put a fake name and phone number just to put it on there, but if you're not prepared to put something on the sheet, you are not dining with us.
I wondered about that. I wondered about business owners' responsibility to ensure that the contact information that they're capturing is actually accurate.
Well, and I did see that on social media with people saying, if you're so upset about it, just put a fake name and a fake phone number. And how much of that is actually happening, I don't know. You know, businesses can ask them to share the most accurate information, but they're not going to sit there and then call you on your cell phone to make sure that you've given the right number.
So are your member businesses, are they using the contact tracing app, the one put out by the Government of Canada? Or are they using?
I'm not sure. No, there's an app you can, one of our businesses has put it in. So it's a QR code. And when you come in, you scan that QR code and it automatically loads your information into a directory for them. So if OPH comes and says, we need your tracing information, they pull it out of this app.
Oh, that's lovely. So Judy, could I ask you to find out what the name of that app is so I can share?
I can send you the restaurant and I'm sure you know the person who runs it and you can reach out to her because I don't know it for sure.
Awesome.
Her manager was telling me.
Okay, Yes, I think I know who it is.
Thank you, Judy. It's helpful to hear from you about these elements. And Lynn, thanks for asking that question. There's always going to be people that don't want to provide their information or comply. But I think most reasonable people really appreciate that. When I'm asked for my contact information, I really appreciate that. I'm like, well, it gives me confidence that if, say, my server becomes unwell, I'm going to know about it. And so the other element is with servers and their log to know which tables, where they serve. That also helps with contact tracing on our end, because customers they could say, oh, it was like a lady and she had brown eyes, maybe, And
I'm not sure many of our restaurants are that big. Rents at a premium in Westboro Village. Our restaurants aren't that big. And with fewer tables, they maybe have one indoor server, one outdoor server. Right? The one thing I would say, and it's confusing because it's not an OPH issue, is reinforcing the Privacy Act in relation to collecting this information. And the first things that came out with that was, oh, well, this is a public health issue, that's privacy, that's separate. It's not separate for the businesses. It's two issues that are being presented in one way, right? So they have to collect this information. And yes, it's not Ottawa Public Health to remind them how they are and are not allowed to use that information. But anytime they're collecting information, knowing how that connects to the privacy laws is really important. So, there was the recommendation not to write everyone's name on one list, because as I'm filling in my name and phone number, I can now see yours, Sarah. Right? And so there's a lot of confusion for the businesses about a list and the privacy laws and PPIDA, like all of that together. And I know that it's not Ottawa Public Health's responsibility to do it, but knowing that that is also a concern from the businesses and from some of the people filling it out. Well, if I'm putting my name on a list, everyone after me can now see it. So there has been some pushback from the public that way.
It's good to hear that. It's good to hear that for the awareness. Thank you for that.
Yeah, because it's when the list is sort of at the front of the restaurant, anyone could come up and flip it. And so there was one tweet that went out and said, oh, we don't recommend you keep this at the front of your restaurant, which is why one of our restaurants has moved to an electronic tracing.
Yeah, much better idea, actually. It preserves it's more efficient and it's more accurate, and it'll preserve people's privacy better for those that are concerned about it. I was very interested to learn that public health laws trump everything else, which that clarity I think was very helpful. Well, other laws in terms of privacy issues, so that gives sort of a legal standing for, let's just do this and do it right and not go into another lockdown. I'm sure that New Zealand is not happy about their having to revert, and they really as a nation have been held up as a shining example of how to do COVID right. They've been so successful, but even those with the best intentions and the best practices, a sneaky virus, I think that's the best way when you described it as sneaky. It absolutely is. So we have to be ever vigilant, and I find these discussions very interesting because the impact that it's had on the business community is unbelievable. So anyway, I'll get off my soapbox because we have a few other people on the call that haven't had a chance to make a comment or ask a question. So I'm just going to start going around the guests. So Linda, did you have anything specific that you would like to ask of Ottawa Public Health today, or a comment that you'd like to share, or maybe a best practice that you've put in place in your establishment? So I'm not sure if Linda is either comfortable in doing so or she may have stepped away from her desk. Robert and Donna, is there anything that you'd like to share or ask today?
Lynn, I'd also say if you have any advice for public health on how to communicate to the public, I mean, I think we do that well, but we're also here to learn from you as the business community, how we can do our work better. I think we're doing a good job, but we need to hear if there's something we can do better as well. What
I really have come to appreciate from Ottawa Public Health is how reactive they've been. So there's a few folks on the call, and maybe they're not asking their questions today, but they might come up with something later. I encourage you to always reach out to me with your questions. I forward them along to Ottawa Public Health. And for a certain number of people attending these workshops, they have gotten some customized guidance for their particular business. We had a beekeeper, for example, in our agricultural workshop, and the issue of how to sanitize beekeeping equipment was unique. And the team actually sat down and came up with customized guidance for this particular business owner. So I think OPH has done an excellent job in not just generalized guidance, but also when somebody has had a very, very specific problem or challenge to actually help them. And these workshops have been a wonderful way for Ottawa Public Health to interact with members of the business community that they might not necessarily meet or come across or be able to get any feedback from. So I love that their guidance is always being informed by our business owners and business leaders. So I think that's terrific. And of course, the quality of the written documentation is, everything's crystal clear, which is really nice. Clarity is everything. There's no ambiguity. It's like, this is it, this is it. It's nice, clear, concise language. So I don't really have any feedback in terms of how to do your work better. But I got to congratulate these people. You know, you have no idea the hours that the team at OPH has been working. And we've been trying to line up some more workshops on different topics as the needs of the business community keep evolving and changing. And it's been an interesting journey and very beneficial for Ottawa Board of Trade and the business community in general. So those are my comments on how you guys are doing. And it's been great partnering with all of you. Justine, what about you? Is there anything that you'd like to put to Ottawa Public Health today? Do you have a question? Or Joanna? We have a very shy audience today. But what I really hope that reflects is that, you know, they're getting the answers that they need if they don't have any follow-up questions for us.
Well, I think, you know, the information that's in the PowerPoint and the tools it's probably the tools that will be most helpful to you. Our local businesses seem to be pretty on the ball here about how to operate safely and reduce transmission of COVID. But I'd encourage you to look at our website or any of the tools that Lynn's going to provide you to help you. The other thing, as Lynn said, if there's anything that comes to mind afterwards, or you're starting as a group starting to notice certain trends or behaviors or come up with you know, challenges, we have this great spokesperson that you are familiar with, Dr. Vera Etches, and she is just a wonderful way of communicating with the public that really resonates with them. And so we can tailor our communications to the community to provide, you know, certain recommendations or advice. So if you're starting to see some concerning things or things that are working really well, that's helpful for us to know. Vera's been a real leader in the area of public health, and that she sees the business community as an important partner. She did before COVID. So all that work that she's done and her vision for how to make our community healthy has been really helpful and supporting our teams and reaching out to the business community. So again, I can't stress enough the important role that you play always, but in particular right now during this unprecedented time of COVID.
Absolutely. So I'm not getting any questions coming in through the chat. And being respectful of everybody's time, I think then we will go ahead and wrap up today's workshop. Just a few reminders. So I will be distributing Sarah's slide deck today. And there's links. There's also links in the chat. If you need any of these resources, please don't hesitate to reach out to me. I will make sure that you get them. If a question comes up that hasn't been covered in today's workshop, please send it to me. I know that Ottawa Public Health will get back to you with personalized guidance. And again, when I send out the slide deck, I will also do it when the recording of today's session is live. So if you want the rest of your team to watch it, or if there are other business owners in your sector that you know would appreciate seeing it, it will be live on our website in about 3 or 4 hours. And please share it. It is information that's available to everybody. So last call for questions, quick. All right, I think we are good. So thank you so much for taking time to join us today. Thank you for being COVID-wise business owners and being concerned about making sure that you're doing everything correctly. And a huge thank you to Ottawa Public Health, who is helping our businesses reopen in a safer manner. And we hope that this will lead to not only a healthy community, but economic recovery in Ottawa. So on that note, I would like to wish you all a great afternoon, and thank you again for joining us today. See you later. Bye-bye.
Thank you all. Bye.
Bye-bye.